prone position. And in almost all the clinical skills exam, you have to stand or sit on the right side of the patient, on the right side of the patient. Then you have to wash your hands and dry your hands. In skill exam room, there is no water, no tape, but you have to ask the examiner, doctor, I want to wash my hands. Then doctor will say, okay, no problem. Wash your hands, dry your hands, and then no. If you are giving intramuscular injection, in injection there is ampule or vial. So you have to check this drug in ampule or vial is for intramuscular injection. Sometimes nurse will give you the wrong injection, or chemist shop will give you wrong injection. So you have to check the injection. It is for intramuscular. It is the same injection, same drug you are going to give, and the dose and timing. Note the dose and timing. For example, you have to give the injection at 9 o'clock. Maybe this time is not at 12 o'clock. And also date and time and dose. You have to give the injection 1 milliliter, 2 or 3 or 4 or 5 or less than 1 milliliter. So be sure that the drug is the same drug, and for IM injection, not for IV injection, and also the dose and time, and also check the expiry date. Maybe possible the drug is expired. So you check the expiry date, and then you take the syringe. Now take the proper size of syringe and proper size of needle. For example, you are going to give half milliliter of the injection. So I think for half milliliter, this is too big. You will take a small syringe. For example, you are going to give 5 cc, 5 ml of injection. So this is small. For 5, it is only 3 or 4. So you have to take the proper size of syringe and proper size of needle. Okay, you have done this. Wash your hands, check the injection, the expiry date, and the for intramuscular injection in the same drug and time and dose, everything. Then you have to expose the injection site. Usually we give the injection in buttock or in the arm. So if you're going to give in buttock, so expose the area, and then in buttock, where you have to give the buttock? In the upper outer quadrant. You have not to explain, but you give. But doctor may ask you, why you are giving in upper outer quadrant, why not in other parts of the buttock? Then you will answer, oh, there's chances damage to the sciatic nerve is there. So you divide that this is buttock, divide in 4 quadrants and give here. Okay.
But doctor, this is the left side of the patient.
This is, if you are going on this side, if you are giving on this side, you stand on this side. Okay. Then before giving the injection, you take a cotton swab and disinfect the area by moving the cotton swab from center to periphery. From periphery, never go to center again. The wrong method is you go from periphery to center. So why it is important? Because when you touch this swab, split swab here, if you touch periphery first, it means you touch the skin of the periphery skin. So there may be organisms, bacteria. So you are transferring this bacteria here in the center. So always start from the center where you want to give and then periphery. And if the injection is in the vial, you have to disinfect the cap of the vial where you will insert the needle to take the injection. If ampule, no problem. If vial, also disinfect the vial. Then take the drug from the ampule or vial, and if you have to give the 2 cc, you take the 2 cc blood, and there must be no air bubbles in the syringe. Remove the air bubbles from the syringe. Okay, and then you disinfect, and then just hold it in your right hand if you are right-handed. Hold in the right hand if you are right-handed. This was the upper outer quadrant. So insert. After that, no, the angle must be 90 angle, perpendicular. If you are giving the IM injection in buttock, it must be needle must be go perpendicularly. If in arm, if you are going to give in arm, where you have to give? In upper third or lower third, not in the middle third of deltoid. The upper third or lower third. Why not in the middle third? Because there is chances to injure axillary nerve. It is nerve here. You will damage the nerve. And here, if you not going to give in the outer and lateral, outer and upper quadrant, you may injure the sciatic nerve. So disinfect the vial cap and the area from center to periphery, and then give perpendicular. In the arm, slightly angulated, but in the buttock, perpendicular, and insert quickly. Insert quickly. Then hold with the support with the left hand and withdraw slightly. Slightly withdraw. Why? To check this, is there any blood. If blood, it means you are in wrong place. Wrong place. And then you have to plunger. With the plunger, give the injection slowly, slowly, not rapidly. Slowly, slowly. After finish, with the right hand, withdraw quickly, and then disinfect it with the other cotton swab, and then slight massage. Quickly. No, needle, you will insert the needle quickly, but the drug slowly, slowly. Needle quickly, then the drug slowly, slowly. Understand this or not? Yes. And take out the needle quickly. And yes.
If I withdraw and I'm in the right place, what will come out?
Nothing. 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 Because you are giving the injection in muscle, not in vein or artery. It must go in muscle. Because this drug is for intramuscular. Intramuscular drug, if you give in a vein, maybe, you know, there will reaction. It will rapidly, slowly, slowly will be absorbed from the muscle. And in the last, what you will do? You will thank the patient. So again, so we need you only to follow these steps. No theory. In examination, will not listen what you are saying. Only we will watch what and how are you doing. Are you doing all the steps properly? Are you miss some steps? Are you doing the steps but not properly? So there are marks from 0 to 1 to 2, 3, 4 and 5 for every step. Sometimes we may ask the questions, for example, why are you going to give the injection in the upper and outer quadrant like this? Then you have to answer, otherwise no. Okay? Now again I am repeating, I am doing. Now I am going to give intramuscular injection. For that, first thing what I have to do, I am Dr. Tahir. I am going to give you muscle injection in your buttock, and I will try it will not make you any harm. Okay? You're okay, comfortable? Okay. Wash my hands. Okay? And during the examination, you have to ask the doctor, doctor, I have to wash my hands. Then he will say, okay. If not say this, it means on this step, wash your hands and dry, you're given 0 marks. Okay? Okay. After that, what you will do? You will take, now we don't have drug, vial or ampule. So you take the vial, for example, this is drug. So you check the same drug which are you going to give, expiry date, this written on the ampule written, it is for IM. So it is for the IM, and dose at timing, check. And if it is vial, then disinfect the cap of the vial. Disinfect cap of the, and disinfect the skin, which part? Outer and upper quadrant, upper and outer quadrant of the buttock. Now the doctor may ask you, why this side? So they will say, to avoid chances of injury to the sciatic nerve. Then you will disinfect this area from center to periphery. Okay? Then you take the drug from the vial, the proper amount of drug, and be sure that there are no bubbles in the syringe. Then what you will do? You will quickly at perpendicular, it means 90-degree angle. But if you are giving in the arm, it is slightly angulated. Otherwise, in buttock 90-degree angle, and quickly insert, and then hold it with the left hand, and with the plunger, withdraw slightly. Check, there is no blood. No blood. Then slowly you inject by your thumb on the plunger the drug. All done. Then you take the disinfect swab and then put it here and withdraw quickly. Okay? Disinfect it, the area, and slightly give massage. And then in the last, thank the patient. Thank you. So during this examination, you have not to talk. Only we want your performance. Only psychomotor skill, psychomotor domain, not the cognitive domain. This is for intramuscular. Now intravenous. For intravenous injection, the initial steps are the same: introduction, permission, and position. For intravenous position, may be lying down in the supine position or sitting position. Lying position is better, but can be given in sitting position. But if sitting position, in both positions, the arm on the line on the table or on the couch. The best side is veins in front of elbow, in the arm. Sometimes may be given in leg and foot, and in the dorsum of hand, but most suitable site is here, the median cubital vein or median vein of the four, or cephalic or basilic veins here. Steps are the same. You check, take the proper size of syringe and proper size needle, wash your hands, dry your hands. Just one. These are the veins here. Later one is cephalic vein, medial one is basilic vein, joining the two is median cubital vein, and this is median vein of forearm. So usually we give in this vein, or in this, or in this, or we will select which is more visible, more obvious. Obvious and visible. We can give any one of these. Wash your hands. Make it dry. And now take the proper sized syringe and proper sized needle. Okay. And then check the drug impure or while the same drug which you are going to give, expiry date, it is for IV, not for IM.
Doctor,
Yes.
are there many syringes that I select one of them?
Yes.
Or
There are many syringes, but in clinical skill exam, there only one syringe this time.
so how can I, did I tell the examiner that I have to choose the proper syringe?
No, you
Choose
have
anyone.
no, nothing to do. You said yes. You can, to show that I know the steps. You can, because only one size of syringe there. So you will say to the examiner, okay, the syringe is proper size. Okay. Because he will give you 5 marks out of 5 in this system. Okay. Otherwise, no need to say. For example, wash your hands. If there is no tape, no water. So, but you have to ask the examiner. For example, examiner, you will say, doctor, I have to wash my hands. How I can give the injection without washing hands? I say, okay, no problem. Then I will give 5 out of 5. Okay. But if you not ask for the water, for the wash hands, then 0. Understand my point? Otherwise, you have not to speak, only perform. Then you will check the zone. Then disinfect. First you select vein. Yes, this vein is here clear. This vein is clear. Now patient must be in lying, supine position or in sitting position. But the arm must be on table or on couch, on a flat surface. Same step. Disinfect from central to periphery. Okay. And same steps are how to take the drug and then remove the air bubbles. Then with your left hand, you have to give here, with the left hand, retract the vein. But before that, for IV you have to do one thing. Put a tourniquet proximal to the site of injection. We don't have tourniquet now. You know tourniquet?
Yes.
It's not tourniquet. Tourniquet. T is silent. Like this.
Yes.
Just put a tourniquet and then you disinfect and this. Distal to the site of injection with your left thumb. Retract the vein and then, when you give the injection, there is a B well. In the needle there is B well, I. Do you understand this? What is B well or I? It must be up. B well, I must be up. Understand what I am saying?
Yes.
Okay. I must be up and then it must be not at perpendicular, about 30-degree angle. About 30 angle with the eye up, B well up. And slightly insert the needle. After that, hold it with the left hand and withdraw slightly. Now here, if blood comes, it means that you are in a proper place. In intramuscular, blood must not come, and here blood must come. Only you put slight tip and then withdraw, you see blood comes. Then what you have to do? You have to inject slowly. And then watch, is there any swelling around the injection site? Any hematoma? Also look at the face of the patient. Maybe it is painful. So give the injection slowly and look at the side, around the side, any hematoma, any swelling, and the face for the pain. Slowly give the shape, and then after that, what you will do, take a spit swab and withdraw quickly. And after that, no need of massage. In the intramuscular, you did massage, here no massage. Take a tape and put it here.
And what about the tourniquet?
Remove the, when you have to remove the tourniquet, you remove the tourniquet when you inject with the eye up, and here slightly withdraw, blood comes, remove the tourniquet. Then insert the needle completely. Then inject slowly. So when you have to remove the tourniquet, you have to remove the tourniquet after you have injected only the tip of the needle and withdraw, blood comes, then remove the tourniquet, insert the needle completely and give the, with pressing the plunger, give the injection slowly. While giving injection, you look the side and the around for any swelling, any hematoma, and on the face for any pain. After giving, you have to withdraw and then put disinfectant swab and then make it tape. And in the last, thank the patient. So these are the steps. If I read the steps quickly, it will be better for you. And if you did not understand any point, please ask. If you did not understand any point, or is there any confusion in any point? Now for intravenous injection, we have this checklist during examination. For intravenous injection, wash your hands and dry. Always use a disposable syringe. Always we have disposable syringe. Be sure that the drug is for intravenous injection. It is written as intravenous. Uncover the arm completely for IV injection. Aspirate the drug from the vial or ampule. In case of vial, its cap must be sterilized. We done this. Provide no air bubble in the syringe. Explain the procedure to the patient. This is in every part of examination that is very important. Introduction, permission and position. In permission, not only permission, you have to explain what are you going to do. So you have to explain, I am going to give you injection in your vein, in your varid, and then reassure, make him comfortable. You will say him, I will try, it will not harm you, it will not make you uncomfortable. So these what you have to say, okay? And then disinfect the skin from center to periphery. Place the arm with a tourniquet proximal to the site of injection. Place for a suitable vein, better a straight vein here in the cubital fossa. Use the thumb to retract down the vein. Left thumb retract down the vein and hold the needle with the bevel up, eye up of the needle. Angle must be 30 degrees. Once blood comes back, insert the needle in the vein and then slowly. And all these steps are same. Intramuscular also the same steps. Did you understand?
Yes.
It's not difficult?
No.
So only 4 minutes usually are given in one station of the clinical skills exam, and 4 minutes are enough. So during examination you have not to explain anything.